Take you live. In the meantime, we'll continue with an update on the government reaction, but here's the opposition for the moment.
The right view. But we have to recognise the right thing when it occurs, and Australians over the long weekend have, in almost all instances, been listening to the message and taking the message on board. Now, of course, one of the ongoing challenges we have is the ongoing disaster of the management of the Ruby Princess cruise ship. It's very important that this ship, which has caused so much damage already, not be kicked into the long grass. We need the government, the federal government, to take control of this situation and take control urgently. Everybody on the Ruby Princess who's left on the Ruby Princess should be tested as a matter of urgency. A plan should be put in place to quarantine and provide health care to those who need it, and to work with the cruise ship company to repatriate anybody who's not essential to get that cruise ship home to its home port. There could still be considerable pressure put on the Australian health system by the Ruby Princess, and this needs to be fixed. These are human beings on board that ship, and they also the ship also provides an ongoing risk to Australia's health system, and it needs to be fixed, and fixed now, and the first step should be to test every person on board. Happy to take some questions. We've got a journalist here first.
What do you think of these comments, the front page of the Oz today, the Border Force boss saying we need tougher borders?
I thought this was an extraordinary contribution by the head of Border Force. In effect, he's criticised Australia's border arrangements. In effect, the boss of Border Force says we need tougher borders and the government needs to provide them. It's an extraordinary public intervention, and it underlines also everything we've said, that Christina Keneally has said and the Labor Party has said, that we need a full explanation as to what role Home Affairs and Border Force played under Peter Dutton's management in the disaster of the Ruby Princess, because it is an admission that the rules at our ports have been more lax than the rules at our airports, and here we have a classic example of a rolling disaster that the Ruby Princess has been for Australia's health system.
Is it an own goal?
Well, it's a clear indication that we need better rules at our ports, and for the head of Border Force to publicly call out the federal government on that, I thought was an extraordinary intervention, and underlines that more should have been done on the Ruby Princess and more should have been done more generally as well.
It's really his own brief, though, isn't it? He's in charge of borders.
Well, he's the head of the agency. Peter Dutton has the political responsibility and the ultimate responsibility for Australia's borders, and he's been called out by a man who works for him today.
Tasmania, we've seen 2 hospitals closed down again because of the Ruby Princess. You comment on that. Did the Tasmanian government mess up?
Look, this is a terrible situation in Tasmania. A couple of points to make. A terrible situation, and again, it goes back to my first point, that there's no room for complacency, because what's happening to the people of northwest Tasmania shows what happens when we have not the proper processes in place. Now, we give our support to the Liberal state government for the efforts they're putting in place. There'll be a time to assess whether more could have been done earlier and sooner. That time is not today. The time today is to provide every support to the people of northwest Tasmania, to the government of Tasmania. I know Beck White, the leader of the Labor Party, has done that, and also to provide support to the federal government, providing more support to the hospitals of Tasmania. I understand the ADF will be deployed. That's a good thing. We called for the ADF to be fully engaged in this national effort weeks ago. Of course we welcome that. It's important, this final point, that there are many health workers who are sick in Tasmania at the moment. We cannot have a health worker die in Australia because of their efforts to keep us all safe and well. Now, this all started again with the Ruby Princess. The northwest Tasmania cluster has been caused by the Ruby Princess. It's again it's a reminder that the Ruby Princess is not a New South Wales problem, it's a national scandal. I might go to the colleagues on the phone.
Hi, Mr. Bowen, it's Dana McCauley from the Herald of the Age. Just on, you mentioned healthcare workers getting the virus. Should the access to hotels for healthcare workers be broadened? I understand at the moment it's mainly for people who've been exposed to a confirmed case. Should this be more of a broad thing where all healthcare workers can stay in a hotel?
Yes, Dana. It should be ideally, and again, this was a suggestion we made some time ago, Jason Clare and I, at a press conference in Bankstown several weeks ago. I welcome the efforts of the state governments across the board to provide more support for health workers. But this is a very important point and a key point that you raised, Dana. It's not just workers who have been positively diagnosed with COVID-19, it's those who are worried about the impact on their family, that they may be inadvertently taking the virus home and infecting their children and their loved ones. And they're very concerned about that because obviously you don't know you've got it until it's too late. So we would welcome very much any efforts to broaden the accommodation provided to those health workers, obviously only those who want to take it up, but to provide more accommodation options to those health workers.